Hello, friends. A very good day to all of you out there. Warm welcome to another discussion today. Let's pass the MRCOG Part 3 in first attempt. Congratulations and celebrations to all of you out there. I'm glad that 1 month back we were discussing that how it's going to be, how would be the results, how did we do in MRCOG Part 2. And today we are here to discuss about the first step towards MRCOG Part 3. Warm welcome to all the RFA champions today. A big hello. How does it feel being here today? How does it feel making the plan of the next step? How does it feel having those memories of being together and studying back to back for MRCOG Part 2 and now utilizing this part for MRCOG Part 3, which is going to be your last part. However, we are here today to make it a successful attempt in the first go. Thank you very much, Anita. I can understand it's a great feel. Yes, Muhammad Nabhan, it feels terrifying because we are new to this part and we just want to know that how we are going to prepare for this. Thank you. Anita says, I'm feeling more confident. That's very good. And that's something which I would expect out of you all. Thank you very much, Shafika. Thank you. Great feeling. I'm happy, Neha. Thank you. And really glad to see you all for this introduction today. Now, we have to utilize this time perfectly. How to prepare for MRCT Part 3. I'm going to start with this introduction. Priyanka, thank you very much. So happy to see you here, starting from MRCT Part 1, then Part 2, and now Part 3. You are one of the precious RFA alumni members. Thank you very much, my dearest. Thank you, Sabah Iqbal. My pleasure. Wa alaikum assalam, Aisha Haroon. Thank you so much. Neha, don't be scared. Today, after the session, you people would be very clear what MRCT Part 3 is all about and how we are going to approach. See, MRCT Part 3 comparatively is easier, but at the same time, if you don't have a right approach, it becomes the most difficult part as well. So we have to make it easy and we have to make it a very, very confident attempt. The very first attempt has to be super confident for all of you out there. Now, I'm going to tell you absolutely, Tammy, my sweetheart, it seems like a dream come true. And today we are taking the first step. You people have to make the next part as smooth as possible for you guys. All right. Okay. Thank you very much, Safa, for joining in and supporting the students all over. Thank you very much, RFA backend team, for always being there 24/7. All right. So, what are we going to do today? I would tell you that what MRCOG 3 holds. I mean, what is the paper pattern? What does it contain? How do we have the understanding of the pattern of MRCOG Part 3? Few students are asking again and again, ma'am, face-to-face or Oslo, how do we need to select out of this if at all we have an option? The biggest question which we are facing after your MRCG Part 2 result is, shall we opt for May exam? Shall we go for the November exam? May exam, ma'am, it's a very little time. Would we be able to do that? November exam, ma'am, would be forgetting all the GREETOP guidelines and the theory part, what to do so we are not able to make a decision for ourselves. So how we have to plan perfectly to be successful. And I'm going to tell you different success stories doing MRCG Part 3 in 1 month, in 1.5 months. And even if you're taking a long-term preparation, you can do it in one go. So all these things we are going to discuss today. I would tell you specifically, and those individual questions as per individual needs and circumstances, I'm going to take in the end. Would that be okay? Everyone, you guys are familiar with my voice, you guys are familiar with my way of teaching, and you guys are familiar that you people have to stay interactive, and I'm going to take all the questions. Yes? Okay, perfect. Thank you very much. Let's begin. So, first of all, I am the happiest person on this planet when I see lots of champions crossing 100 plus results. So undoubtedly, this feel is overwhelming. This feel makes us feel proud, of course, and top of the world. But I just need one important aspect to understand. I always say that failure doesn't last forever. We can change it into success, and success is not always everlasting. We have to work hard for the continuity of the success as well. So I totally understand the feeling of being victorious, the happiness all over, that is being enjoyed, and you people are enjoying all over in terms of celebrations, parties, dinners, treats, all that is going on. I do understand, I do respect, and this is what you all deserve. But 2, 3 days, and it's okay. Now we need to work hard again. We should take this victory as a challenge of having the next victory in a row. This victory should not make anyone out of us overconfident. Do you guys get that? When we achieve one success, we should not forget that we worked hard for it, right? So the next step, it should not be a difficult one if you have a continuity. Wa alaikum assalam, Sumaya, my dearest. Thank you very much, Pathan, for joining in. Thank you, my dearest. So, no, you guys are super happy, Anusha. So am I. But the hard work you should not forget, because none of the success it comes without hard work. So I want the continuity of the victories. I want the continuity of the success, not that this success we should be, get absorbed in this so much that we forget that we have to work hard as well. So planning for MRCOG Part 3 should start today. I've already given you celebration times and you've got 3-4 days for the celebration. Now is the time that you should plan MRCOG Part 3, because we always achieve a target only when we plan that target. Yeah. So today we have to make our future plan. When are we going to take MRCOG Part 3? Many of you are already in the paid groups, would be given the schedule. You people are going to start the study. So you are going to start your plan now. And according to your plan, you would be targeting that how we have to practice and how we have to make it in one go. So starting the practice should start from now, because MRCOG Part 3 is all about communication. It's all about practice. It's all about understanding the system, and it's all about sharpening your skills. I would always, like to appreciate that every student has got some strengths. We all have got some strengths. But the thing is that we need to polish those strengths to stand out, as it's a competitive exam. Yeah. And at the same time, we all have weaknesses as well, because nobody is perfect. So we have to work on our weaknesses to make and convert them into strengths, and that too in a group. MRCOG Part 3 is not an individual study. It's always that you keep on speaking with your buddy. It's always somebody listens to you to tell you have more of the hand movements. See, you don't realize it yourself, but your buddy realizes it, that you move your hands too much while talking. So you have to reduce that movement. Yeah. At the same time, your buddy says you are telling the role player name so much time. I think it's like 2 or 3. It's okay. It gets like too much evident. See, you have to understand that MRCOG Part 3 is about speaking and understanding that what you guys have to speak in that 10 moments, 10 minutes, because 10 minutes, you people are not going to get even a single minute after that. If you have lots of information and you can't speak that in 10 minutes, unfortunately, the station would be failing. So keep all these important points in mind. Big hello, Tanya Islam Chaudhry, and big hello to all my Bangladesh students. Thank you very much. You people had spectacular results this time. I'm really glad. Thank you very much from the entire Alpha team, Tanya. Thank you. All right. Okay, so now we've got many students in the May batch, and I think November 1st batch today, Safa was telling me that that's also completed. Thank you, Asma, my dear. Few of you have taken a decision of May, and few of you have taken a decision of November, and half of you are still thinking May versus November. I will be very open and honest to you guys in this, that MRCOG Part 3 depends upon where you stand today. Many of the students, they've got a very good, communication style, or they have got very good grip over the language. They just have to understand that how we have to speak in those 10 minutes and what are the important points which we have to cover. All right. Kesser, my dear, whichever course you want to book, please drop in a message to Safa. She's going to add you. You can get added in the paid group today, because the active seats are getting over. All right. Okay, everybody, please pay attention here. Now, you should be understanding this thing that it depends upon everybody's baseline. All right. Few of the students, they are very good in communication in their clinics. Few of the students, they are actually using the English language as communication tool in their clinics. Few of the students, they are absolutely in different attire. They use their local languages, they use Hindi, they use Arabic language, they use different local languages for their communication. They are not dealing with the patient's counseling too much, right? So, then I would say that this time, right? No worries at all, Shweta. You're going to do it, sweetheart. You would do it this time. So you all have to understand that when it comes to the communication, every language in the world, that is doable, that's understandable, and you can learn it. So what do you guys think that what is the best way of learning a language? For example, I wanted to learn Arabic, so I start practicing Arabic, right? Yeah. So my sonny is so good in French, or if you talk about my daughter, she's so fast in Spanish. What's the reason? Because they practice those languages. Do you guys understand? The idea about practicing a language and getting better is only communication. Language is never understood, or the communication is never done on reading basis. It's always done on what basis? On speaking basis. Do you all agree with this? Yeah. Today, if I give you a paragraph and you start learning it while reading, no matter how difficult it is, you would fumble for the first time. You'll read it 3, 4 times. Your speech would be without fumbling. Do you guys understand this point? So if you think that you can give 6 to 7 hours and you think that you don't have any other things which are going to disturb your routine, please go for May. That's not a problem, provided you're able to give that expected time for your preparation. Generally, 2 to 2.5 months are something which you can just learn, or you can do the part 3 in this time period. But having said that, if you're committed, if you think that you have a little more, you individually assess yourself that you are a little shaky in your communication, or there's so many commitments from the hospital, from the household, that you can't give much time in 2 months, then pair in November. The cases, may that be May, may that be November. The the start of the preparation has to be today only. Why? Because it's not a one-day preparation. It is about learning and speaking. It's about learning the new things and doing a recall of the older things. Like if you're reaching at 50th station, I expect that you start revising your first, second, third, fourth stations. Because if you do the new things and you don't revise the older ones, you tend to forget the older ones. Do you all understand this point, everyone? Yeah. So it's all about how much time you can give. Do I have any questions regarding the May and the November? Any query you guys have? Because then we are going to go to the MRCT Part 3, what it contains, so that you all can individualize yourself and understand that what is the final decision for you guys. If you have taken May exam preparation, I want at least 6 to 7 hours, because that's the only way. At least 6 to 7, Muhammad Nabhan. At least this one. Anusha, this time it is 2 Indian centers in May, and we've got one Malaysia, and we've got Singapore, and we've got 2 Osler online days. This is for the May diet. November diet has not been announced as of now. Next exam is going to be in November, but the diet or the centers, that's not been announced so far. Okay, we are awaiting for the February results, February exam results. So after that, we'll be in a better position when, as soon as the college announces the diet, we are going to tell you. All right, okay. May has been announced, my dear. May, Anusha, 2 days is on site in India. All right. It's Malaysia and it's Singapore as a center. And 2 days, we've got Osler exam as well, which is an online exam. All right. So my question to all of you is, no matter we are taking May, no matter we are taking November, shall we take rest and 10, 15, 20 days? Let's celebrate more MRCT Part 2 and take a start in after 1 month? Or shall we take a start today? What do you guys say? Are we all ready to take a start today? Yes or no? Or shall we take a start after 1 month, after relaxing, after enjoying more? No, I'm asking. What do you guys say? I can never think of this, Anusha. But that to my students. Yes, that's what I want. You people should understand what MRCT Part 3 is and start practicing and start learning. Gather up your things, gather up your notes, gather up the study material. That's the first step and start doing today, right? Ankati, the priority booking is when you are of that area. For example, all the Indians will get a priority booking for India, right? Now, what happens is that last time when the Indian seats, the students of India, they got booked, then the distant students of other countries, they got the permission to book India. Like many of my Bangladesh students, they traveled to India for the center when they didn't get the Osla and the Indian seats were vacant. Do you get it? So that won't be a priority. That was the secondary booking. Pankti, do you get that, my dear? Yeah. Anita, the seats are never as in fixed. They are appearing on your link. You get to see them and then you book accordingly. However, Osler is a little difficult to get the seat. Why? Because the whole world is competing. All right. iPhone. Is it Sanchita? Is it my same Sanchita who always comes with iPhone? Yeah, or is it somebody else? Hello, Mash. Thank you very much for joining in. So happy to see you, my boy here. It's Naseem. Yeah, Naseem is also iPhone in part 2, I remember. All right, guys, the November diet has not been announced as of now. All right, I'm going to take this question, Janvani. I'm going to take this question online or offline. I'm going to do a comparison today. All right. Can Indians book online seat? Noor, generally they're given the on-site and the Osler last time they did get, I think Safa would be in a better position to tell, but they give a chance. Yeah. All right. No worries, Naseem. No problem. May is in UK. Absolutely yes. November would also be in UK. Both are the UK diets. All right. Absolutely yes. All right, Roshna. Yes, for all November batches, I think today only the moderator was telling me, big hello, Mash Rage. Today, moderator was telling me, I think the active season of one batch is over. So we're going to open up the November. Whosoever wants to join, you can definitely join. All right. Okay. So now, up to now, we have decided that we are going to start preparation for the MRCT Part 3. So a big yes I've got from your side that you people are ready, that we are going to continue that hard work and the tempo should be there, then how we have to be successful in MRCT Part 3. The first thing of approach of any preparation is understand the exam. And that's what I'm here for, to make you understand the exam. Because once we'll understand the exam, then only we'll understand that what's the starting point of MRCT Part 3. All right, very well done, my dear. Thank you. So the most important thing for MRCT Part 3 preparation is understanding the language of the role players while speaking to them, how they have to talk. And that is through patient information leaflets. Do you guys understand? Patient information leaflets. Have you ever heard about what patient information leaflets are? Yes, do you guys know that? Patient information leaflets is any language with which you're going to explain to the patient. So patient information leaflets for anything is very important. In early pregnancy, you've got molar pregnancy, right? You will open up your notes of MRCT Part 2, where you have written the recommendations of the molar pregnancy. Please do not give 2-3 hours to the Green Top guideline, but just 15 minutes scanning and revising the recommendations and then reading the patient information leaflets. Why? Because that would tell you that in patient information leaflets, what is the language being used to tell her what molar pregnancy is, how we are going to tell her about the beta HCG. It would not be beta human chorionic gonadotrophin. It would be a pregnancy hormone, right? How we are going to tell her about the follow-up, how we are going to explain salpingectomy or salpingotomy to her. Generally, the questions in the patient information leaflet, which they have written as per the college leaflets, the same question the role player asks you. Can you tell me, doctor, what this is? So, doctor, what about my future pregnancies? So what would happen, doctor, after the surgery? Would it be an open surgery? Would it be a keyhole surgery? So these type of questions the role player asks, you have to come up with that information from the Green Top guideline. If at all, and your blood pressure is falling, your heart rate is rising, we are going to go for the open surgery because it tells us that maybe there's a torrential bleed inside your tummy. See? The laparotomy indications, which we have already knowing about the ectopic pregnancy, right? And if we have the ectopic pregnancy expectant management, we're going to tell her that as per your ultrasound, that fits into the condition where we can wait and watch and perform an expectant management where we let the nature takes its course. Do you guys understand that when you're doing any sort of a guideline, you do ectopic pregnancy, you do its GTG recommendations, but the idea is that you should be knowing how to explain to the patient, and that too should not be a theory. It should not be an essay writing. It should be the smallest possible sentences understandable to the patient. Why? Because you've got a limit of 10 minutes. Thank you, Sanchita, my dear. So happy to see you. Sanchita, do see my WhatsApp, my dear. Your video was cutting in, so I asked you to send to the Telegram, sweetie. Okay? Yeah? Thank you, my dearest. Thank you. All right. Did you guys understand that how we have to understand the patient information leaflets? Now, you people have to go to my Telegram channel of the books. All the patient information leaflets, booklets are given there in the form of PDF. If you're happy to read as a printout, you can take a printout. If you're happy to read on your iPads, you can read it that way. If you're happy to read on the screen, please do that. Anita Dilip, the link is in the group, but if you people don't have, just remind me all the links. I'm going to give it just after the session. All right. All patient information leaflets is in one channel. Do you guys remember all the channels which we used to have like in part 2? Yeah, everyone? Same way, everything is there in the channels. You don't have to Google anything at all. Everything is under one roof, under one link, and you people just have to search there. All right, all the modules, they're together under one link, and you don't have to search anywhere. Anita, because you just joined today, sweetheart, please, everything would be there in the groups. All right, absolutely, yoga, all the record would be there. Okay, this recording would be there. Okay, so far am I clear? So the most important thing, which is the transition from MRCOG Part 2 to MRCOG Part 3, is patient information leaflets. Now, we've got books, and what are the books to follow? We've got a wonderful college, Royal College for Obstetricians and Gynecologists, Lisa Joels, which is wonderfully given. There are only 14 stations, but every station gives us a beautiful idea. And then we have got the Oxford speciality training. Then we have got Tony. Tony is generally for the Australian students for their exam, but still has got a wonderful collection of a structured discussion, what that means. I'm just going to come to it in a bit. We've got beautiful book of Get Through and a wonderful Justin Kunje. I remember you guys used to practice Justin C. Kunje so much for your extended match questions in part 2. So here we have all these part 3 books as well. Now, the fast track is different from the regular course where all the books are sold and all the templates of these books are going to be there. Once you book your exam, we will be telling you it would be on your portal, but these books are secondary in your preparation. Right? Yes, Anita, your love and Safa's love, yeah? All right. So you all have to remember that you all, no worries, Yoga Priya, please get connected. Yes, you can listen to the YouTube. Yes, yes. I know that you guys love this Sakuja's book, and hats off to you guys that how many times you guys practiced and then even corrected many questions. So I know the hard work, how it had been. All right. So this is going to be your books. Have you noticed all the books, please? All the books, Priyanka, are in the channels. You people don't need to just search for them. Under one channel, all the 5 books are there with all the patient information leaflets. Do you guys understand? So the first step is please write down. You all are going to get the channels in your paid groups. All right, in your paid groups. In 74, 75, 76, you will have it there. The November people will be having there. All right. No, the channels are in Telegram, but the paid groups are WhatsApp. Yes, the paid groups are WhatsApp, but the channels are going to be same as that of your part 2. Okay, all the channels were there. Got it, everyone? Yes, clear so far? Yeah, so this is the first step, that before sleeping, you people have to organize your study material, gather up the study material, because we have promised that we are starting today. It's never a one-day task. So today you'll gather up all your things and you'll step up towards a broader horizon. And what is that? That is about practice. How we are going to practice, we need to understand the exam pattern first, right? Okay. All right, Anusha, my dear, the link is already. Anusha, you're there in the WhatsApp, right? Safa, are you there? Safa, sweetheart, are you there, please? If not, busy in the clinic. Girl, are you there? I know this is your clinic time. Yeah? Okay, I think she is not here. Okay, she's here. Anusha, please, yeah, Safa, please give Anusha the link, right? Yeah, and she's for November. Okay, so please do add her in the November group. All right. Thank you, sweetie. Thank you very much. All right. So first, understand the outline of the exam. The outline, all those who are in the paid groups, all the channels would be with them. Okay, all the channels would be with them. Okay. First of all, please understand that this is a circuit. So I'm sure in many exams of your local exams of your obstetrics and gynecology, you must have gone through the circuits, right? Circuit means that you should be knowing about having a complete circle of station, right? You should be knowing about that there are 14 stations. All of you, please try and understand the point that we do not have any break. For example, a complete circuit you're going to have, starting from if station number 1 is going to be your first one, you're going to have station number 2, station number 3, station number 4, and you're going to end at your station number 14, right? You people have to understand this point that if you are starting from station number 4, so you'll be ending at station number 3. Do you guys understand this point? It's like a complete circle. Let me tell you once again that there are different cubicles like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Did I make it correct? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Let's make it a bigger one. And I'll make it easy for you guys so that what I want you to understand is that you guys understand just today and how it's going to be. 2, 1, and 14. Okay. Now, what happens is that 14 students, they will start just now. All right. So if you have the Joseph, I actually don't know what I spoke that day, but introduction stays the same. All right. You can listen to it on the YouTube. Okay. No worries. All right. Everybody, please pay attention. 14 students would be in one batch, 14 candidates. Everybody try and understand, please. 14 candidates would be in one batch. And they're going to start with like first candidate would be standing here, 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 and here, and here, and here. Okay. So 14 would be there and they'll start revolving. Sixth candidate on the 6th position will go to 7th, 8th, 9th, 10th, 11th, and will end up at 5. Do you guys understand that how the circuit goes? Everyone, do you guys understand that how the circuit goes? So it's a continuity. The first one will start from number 1 and end at 14. The second one will start from this 2 and end up at 1 because it's a complete circuit going on and everybody would be rotating. 2 minutes, they'll stand outside the cubicle and the instructions will be here. Outside the cubicle, they're pasted on the cubicle. And 10 minutes, they'll go inside and form the station. Do you guys understand this point, everyone? Everyone, do you guys understand that how the circuit works? Yes, I just want to give you a good grip over understanding the exam so that you start visualizing yourself doing the same. All right? In this way, your 14 stations would get over. Now, in European board, we've got less stations in OSCE. In MRCPI, there are rest stations in between as well. You know, there are 2 minutes gap, 10 minutes gap in between. But in MRCOG, there's no rest station. Believe me, these 168 minutes are the fastest in your life, I always say. So in the first station, you're thinking that, yes, you're taking a start, and you just take your breath back once you are in the last station. It's like back to back, 2 minutes, 10 minutes, 2 minutes, 10 minutes, and 2 minutes and 10 minutes. Am I clear about that, how the exam works? Yes. Now the question arises, what are the type? Very well done, Tanya, if it's the same. So you've been through that. Lovely. So now you should understand that what are the types of the station. We have got 2 minutes are to read the station, Anusha, and 10 minutes is to perform the station. Got it? 2 minutes to read the station and 10 minutes to perform the station. All right? Okay. So the types of the station are a structured discussion. In structured discussion, it's you and your examiner only. There are going to be 4 stations as a structured discussion where you guys need to understand that it's going to be an examiner talk, an examiner viva. So you're going to talk all the medical jargons, the medical language, everything will be there. Okay. Then you're going to have 6 stations in which 3 people would be inside. You, that's going to be your examiner and a role player, where you guys would have the simulated patient task, right? You are going to have a communication with the role player only. Generally, the examiner doesn't interfere in the talk and sitting quietly, just observing you and marking the scheme. That's it, right? The last one is the simulated patient task with lay examiner. So there are 4 stations for 6 plus 4, 10, and 10 plus 4, 14. So these 4, the difference is, again, it's a role player, but we've got 2 examiners marking you. Generally, the sensitive stations, they come as layman examiner, like breaking bad news, like sexual problems, like rape cases, assault cases, like pelvic inflammatory disease, any sort of a breaking bad news, cancer, IUFDs, they all come in the layman examiner stations where you are being marked for the same station, but by 2 examiners. So what difference does it make? So this is generally how the college, looks like at the situation. They keep on revolving you in different circuit. So because there are many circuits going on, like when we were taking our exam in UK, it was 3 circuits going on, one on the first floor, then it was on the ground floor. So 14, 14, 14, 3 circuits were going on at the same time on one day because there are many students. So multiple circuits are going on, 14 in one circuit. They label it as you are in circuit B, or you're in circuit A, or you're in circuit C. It's given on your email that you are candidate number 5 in circuit B. That means you'll approach the circuit B, you start from station number 5, and you'll end at station number 4. Okay, so your email already tells you that your circuit is which one, and your first station is which one. Do you guys understand? Yeah, so you clearly know that from where you're going to start and what is your circuit. All right, so that is how you already know through the email. So please keep a note that if you have got 4 people inside, that's a layman station. You should be knowing about. If it's only 1, it's a structured discussion. Your examiner is going to ask questions like the medical thing. And if there are 3 people inside, it's a simulated patient task. Walaikum assalam, Masra Jan. Thank you very much for joining in, my dear. Thank you so much. All right. Now you should be knowing that layman examiner stations are most important. Why? Because for the same thing, for your same performance, you will be scored twice, one by the clinical examiner and one by the layman examiner. Remember, the clinical examiner is an obstetrician and gynecologist, please. The layman examiner is not an obstetrician, right? They don't know what medicine are you prescribing and is it a correct prescription or not, right? The layman examiner are basically the examiners which are actually assessing you on your communication, your attire, your acknowledgement, your settling of the patient, how good you are in handling the patient. So they don't have your obstetrics or gynecology to test or to mark you at. Are you with me, everyone? Are you guys following me for this, please, everyone? Yes? Am I clear? Did you guys understand that what the layman examiner stations, or what is the duty of the layman examiner, is assessing you from head to toe on your attire, please. All right? Now, how do they mark you, Ozas? How do they mark you, Kasser? How do they mark you, Zalek? They mark you on the basis of the domains. And what are the domains? Information gathering, communication with the patient and relatives, communication with the colleagues, apply clinical knowledge, which is your all theory part, which you have done in MRCOG part 2, and the patient safety. Now, the scorecard is very clear. They've got complete points in the scorecard, like information gathering. You touch this point, they'll go like tick, tick, tick. Patient safety, you've touched the points in the scorecard. They cannot manipulate that because they've got strict points in front. You touch them, they write like tick, tick, tick. And if you miss them, they just put a cross and if you're missing out something, right? Remember, knowing the domains and knowing the scorecard is very important, because it's not that you are doing an HMB station and you teach the entire HMB, but you don't follow the scorecard. I mean, what examiner wants to hear, you should be understanding that this is the gist of the station. Here, the biggest problem occurs. Even today, if I ask you, I'm sure 100% of the students here in the meeting now, they know heavy menstrual bleed. They know what palm coin is. They know what investigations we have to do. They know what's the first line medical and the surgical. But how we are going to put it into words and how we are going to counsel the patient and how we are going to complete it in 10 minutes is the beauty, the practice of the stations, which you guys have to do. All right. So whatever you fix in, they just mark it. Marking 2 means that they're passing you on this, right? Marking 1 means that you're borderline on this, and marking 0, unfortunately, means that you're failing in this station, right? So they mark you for each domain as pass, that is 2, 1 as borderline, and 0, unfortunately, that you absolutely messed up that domain and you did not pass, all right? So please keep a note of that in exam, that the marks distribution are maximum for the layman examiner station. What's the reason for that? Structured discussion, generally, we have 4 structured discussions. And there are 3 domains being tested. We generally do not have information gathering in the structured discussion, you know. So out of that, 2, if it's maximum 2 plus 2 plus 2, so you get 6 in each station. So 4 total are there. So in your exam, like 24 is the total score for structured discussion, which is like the minimum out of other types of stations. If you do the simulated patient task, you've got 4 domains being tested in the simulated patient task. So in them, if you score maximum, that's going to be 8, and 6 simulated patient tasks are there. So 8, 6 are 48 for this. So please keep a note of that in exam. That is important that we understand this, right? In this situation, you people should be knowing about the fact that in exam, the most important is always the station where you guys have to click and be really good on the layman examiner stations, because the clinical examiner would have your 4 domains and the layman examiner would not have the applied clinical knowledge, because as I've told you, is not an obstetrician, but would have the other 3. So that clearly means in that situation, you should be knowing that in this station, we are going to have the layman examiner marks plus the clinical examiner marks. So that makes 32 plus 24. So even the 4 stations we have is going to have our 56. So that makes bulk of your exam. Do you guys understand that how it makes the bulk of your exam? Because this is the maximum. Like even for these 4 stations, we have so much of a score because 2 examiners are there. Could I make myself clear? Did you guys understand that? If you understand the importance of the topic, it is something which you'll understand that where we need to put more attention, right? Ola, this type of layman examiner stations are always highly scored. So if you pass these 4 stations, the chances of passing the exam is very, very high. They would mark us on the basis of the domains and the scorecard which they have. So the scorecard is fixed on the basis of the task that has been given to you. And when we do the stations, you'll understand that how we deviate from the scorecard, how we miss out certain points and we start teaching the unnecessary things or start speaking the unnecessary things. All right. So first of all, you need to understand the importance of each. For example, I just want to give you one example. If at all, 1 structured discussion out of 4, 1 out of 4 doesn't go good. I mean, you're unhappy because earlier wherein aging was there, it was from the talk article and you didn't revise that. Does it make so much of a difference in your exam that you mess up your SPT or the layman examiner on the basis of that? Do you guys think that one SD going wrong should should make you nervous for that like upcoming stations? The answer is no. You should tell yourself that yes, I do have a chance and still I can pass the exam because structured discussion has the minimum score in the total exam. Do you guys understand my point? It's not that we are going to mess up the structured discussion, but if at all it happens, you should know the value of each station in exam. Muhammad Aman, are you there? Mash, are you there? Ola, do you get that? Somia, my dear, do you get that? Yes? So you should be knowing the importance of each station in exam, right? Am I clear about the scores and the marking, please? If not, let me know. I'm going to repeat that again because then we'll start going towards understanding the pattern. Hmm? Generally, I always say yes, but if two stations go borderline or one station goes failing, Mohammed, even then we manage to pass the exam. You have a margin of like 3 stations in exam. But again, Mohammed, it's a competitive exam. It depends upon your circuit as well. Please don't say that, Mohammed. This is maximum which I can allow, right? Now, the biggest thing which you guys have to understand is understand the domain, right? Understand the domain. What is that? We are going to start with the most important domain, which is almost part of all the stations other than the structured discussion. What's that? It is information gathering. See, when we start the station, we start asking the information, which we are being scored for. For example, it's a patient with an early pregnancy and she is bleeding. So we need to evaluate her. So we are going to start with the history taking. We'll perform her examination. In face-to-face exams, we do examination. Please, the Osler, we omit the examination because it's an online exam. We don't perform examination. We don't say that even, okay? And then we send the investigations. Or we ask about if investigations have been done. Information gathering, I always say, should be perfect. Why? Because it's starting off your 10 stations. So with 10 stations starting, it is the most important thing which you people need to understand. I will give you my fixed information gathering template, but we deviate from this template according to patients listening, that what are we missing out and what we need to practice upon. Like presenting complaints, what are they? History of presenting illness, we are going to ask about that. Then our obstetric history, gynae history, medical history, family history, and then after family history, we go with the surgical history, the drugs, the personal, the social, and the mental health. I have my mnemonics, which when I'll teach you guys will tell you why, because I immediately used to write my, OG, MFS, and PDS. So I was always like outside the cubicle, I'll put it like OG, MFS, PDS, and I'll be like putting tick, 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 tick. Okay, O asked, G asked, because you don't have time. And under nervousness, you tend to forget. So I'll prepare you guys in the course that what you have to do in 2 minutes so that your 10 minutes are superb in performance. All right. So my mnemonics, I'll just tell you that you just have to write on 2 minutes in the paper when you're outside the cubicle. All right, tick, 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 OG, MFS, PDS. So you go inside. Even if you're forgetting something, you're going to put it inside. Do you guys understand that? All right. Do you guys understand that, please? Okay. So that is the biggest concern that you have to is the most important thing. All right. So with this, please keep a note of that in exam, that if it's going to be a situation where you should be knowing about the history deviating from the normal template. It's not that you just learn it and you make it in the same sequence and you put it in all stations. That's the biggest mistake that students they do. They do not do the alter history taking when they are having different stations. All right, please keep a note of that. What does it mean? It means in this situation, for example, if it's an ectopic pregnancy, you're going to start with this, but HOPI would be different in each case. Patients can have the Jehovah's Witness possibility because of the bleeding tendency. So you always ask the history and you start with your introduction. Hello, I'm Dr. Mash. I'm one of the doctors in the early pregnancy assessment unit today. May I confirm your name and age? Is it okay I call you Anne? I've gathered from your case notes that you're here today because you're having some bleeding and you're in your first pregnancy around 6 weeks. Is that right? I'm here to address all your concerns. Can I ask you questions? So do you have any pain or do you want any medications prior to I ask you questions to you? See? So you settle the role play. And then you say, as an open question, can I know more about your bleeding? So she comes up with whatever is in the instructions. And then you ask about the pregnancy, the gynae history. So you ask about the previous pregnancies. You simply ask any medical illness for which you see your GP regularly, any family history of concern, any operations on your tummy or down below. Are you taking any medications at the moment? Do you have any known allergy? And do you smoke? Do you drink alcohol? Pardon me asking, any recreational drugs? So what do you do to live, and how's the support at home? May I confirm that how had you been feeling generally in the last few weeks and months? See, so your history gets completed. So it takes around 4 minutes, please. So what are the don'ts in the history taking which makes us fail despite knowing? If the diagnosis is given, please do not ask all the history points. This is the biggest mistake. For example, one case is, everybody please, let's be open-minded and understand. One case is that the patient is having bleeding and she presents to you at 6 weeks of pregnancy with bleeding, right? So you are going to ask every question to rule out the differential of an early pregnancy bleeding. Am I right? Am I right, guys and gals? You will ask everything to rule out ectopic, molar. You'll ask about the vesicles. You'll ask about the shoulder tip pain. You'll ask about any ultrasound had been done to confirm the intrauterine pregnancy. Yes? But on the other hand, if the case says that she presented with a bleeding and now it has been diagnosed as ectopic pregnancy, do you need to ask everything regarding the early pregnancy bleeding when a diagnosis has been given? So if you just follow the template, you start asking everything and here we go wrong. Do you guys understand? So mold yourself, learn the template, but try to adapt according to the situation. It's all about listening to the role play and actually molding oneself according to what is the task and what's the requirement. Do you guys understand that? Right? And if history has been given, if it's given that the BMI is 23, please don't ask the BMI. If it's given that she's a smoker, don't ask it again, right? And if it's an emergency case, she's having acute abdomen, she's bleeding, don't ask about even smoking alcohol because these are not the emergency questions. Do not exceed more than 4 minutes. Why? Because if you're exceeding more than 4 minutes in the history, then you're taking your time from the management plan. So history might get passed, but the applied clinical knowledge and the patient safety would be getting failed because you don't have enough time to manage the case. Am I clear, everyone? Did you guys understand this? Did you guys understand the information gathering, please? So this would be your first 4 minutes of your station. Clear? I can't see a message in the chat box. Thank you, Saima. Thank you, Mr. Thank you, Asma. All right, that's perfect. Okay. Now comes the second domain, which starts from your introduction. Your hello to the patient starts your communication. And from your bye-bye till the end, your communication is going on. So it is like you should be knowing how to be simple to the patient. As I told you, the patient information leaflets. You should be able to negotiate, engage, keep checking on the understanding, and whatever decision you're taking should be a shared decision with the patient. So the patient information leaflets are going to have the all details, which is going to help you with this. All right. You're going to have the engagement. Like you keep on checking understanding. Are you with me, Anne? Yes. Are you following me so far? Do you have any questions? So keep on doing this way and start doing these skills accordingly and keep practicing this. All right. So with this, where do we have the difficulty? When students, they forget their introduction. It's so common saying, hello, I'm Dr. Preeti, and I'm one of the doctors in the antenatal clinic today. And the station says that you are in the early pregnancy. Do you guys understand? So you should be knowing that where you are. And then you start feeling, embarrassed asking the questions of some sensitive, like sexual life, and you speak so many jargons. In your patient talk, if you speak so many jargons, for every jargon, your score gets reduced. So you don't have to speak big medical words, right? So always be easy and do not use abbreviations to the patient, please. Keep a note of that. This actually reduces the score of your communication with the patient, right? So communication skills are always developed by practicing with a buddy. And that's why in your study group, you will have your buddies. You will start practicing with them. Always break the information. Keep on checking the understanding. Always give 4 or 5 points in the notebook that you have to speak. Are you with me? Are you following me so far? Do you have any questions for me? Am I clear? So all these things, breaking your information into this, please keep a note of that in exam. All right. Then comes communication with the colleague. Communication with the colleague is MDT, consultant obstetrician, and then specialized midwife, and also the neonatologist and the hematologist, all these. So when would it be happening? All right. In this situation, please keep a note of that in exam. So in exam, you should be knowing about being very clear that you have your communication with a colleague as a domain. Please do mention that very clearly, that this is going to be the team effort. It will be the team of doctors, and that contains score. I always say to the students that this is the easiest domain to score, and unfortunately, the easiest domain to miss out as well, because it's just one single line. You don't say that it would be team of doctors and you just fail. You just miss out. All right. So please keep a note of that in exam. So please ensure that you are logical. You are an ST5 in exam. So whenever you need your consultant, mention. But if something is of your capability and you mention your consultant, even then you go wrong. Right? Do you guys understand this, please? Yes? So please keep a note of that in exam. It's very important to understand this. Communication with the colleague, Ritu. For example, it's a sickle cell disease. Ritu, unmute yourself. Ritu, sweetie, unmute yourself.
Hello.
Yeah,
Hello,
hi, sweetheart.
ma'am.
It's a sickle
Hello,
cell
ma'am.
disease case, right? In pregnancy. All right. So in
Okay,
sickle
ma'am.
cell disease, in pregnancy, we need to understand that what would be the importance, and what would be the importance like. For example, what is the involvement in sickle cell disease? It has to be a consultant obstetrician, correct? Yeah.
Okay, ma'am.
It would be the team of doctors. We need to have the sickle cell doctor, the blood doctor, like hematologist, we are going to call the blood doctor. Okay. It would be a specialized
Okay.
midwife who deals with the situation, right? It would be the baby doctor in the later part of the pregnancy, and the anesthesia doctor as well. So it would be a combined care plan. This is your
Okay,
communication. Whosoever is involved in the care plan, for example, it's a bladder injury or it's a ureteric injury. So it would be the consultant, it would be anesthetist form, it would be the scrub nurse, it would be the operation theater staff, it would be the urologist there. See, intensivist there, or the high dependency unit care staff would be there. All this is communication with the colleague. Understood? This, whenever you
Yes, ma'am.
require colleagues, you're being tested in communication with the colleagues. All right? And please don't miss out. Again, unnecessary calling the consultant fails you in exam. And when you can do something, or if it's a PPH, you people have to inform the consultant. As an ST5, it's an important thing you people have to understand. All right. So please keep a note of that, that it is very important that you guys understand that in exam, you guys are as an ST5. So please try to practice your skills, and you should be knowing that what are your responsibilities. Now, the biggest thing and the most important domain, which students that don't understand, you've got a complete folder on your website, the ones who have subscribed. Please go to the website, go to the OSCE templates. There's a complete patient safety folder. All your modules, patient safety points are there. Starting from confirmation of the name of the age, the allergy documentation, examining in the presence of a chaperone, and calling for help when it's beyond your capability and your expertise, mutual decision making, respecting the confidentiality, assessing the mental capacity. All these things, they come into the patient safety. And you don't have to forget that, because side by side in your speaking, you are doing a patient safety as well. The duty of candor, the incident reporting, the risk management, clinical governance, this all is actually the patient safety. When we'll be doing each module, specifically, I'll be very, very strict in patient safety, because this is there is a huge chance that while doing the station, you forget the patient safety. Please keep a note of that in exam. All right. We do not understand the clinical governance. We forget the audits, the risk management, the root cause analysis. So that where actually we miss out the patient safety points, especially in the post-operative complications and the surgical module. So I will tell you specifically the bowel injury stations, the ureteric injury stations, the bladder injury, hematoma, all these are the recall stations, exam stations coming up again and again. So you need to be very clear in this clinical governance aspect for exam, please. All right. Now, how we have to do the patient safety. In this situation, you should be practicing and writing down all the points of the patient safety side by side. All right. You should be knowing. I tell in the session as well that for each station, when you're doing that, put a stick on, or at the end of the station, give a heading patient safety and write all the safety points of that station. Why? Because in the last 2 weeks, I want you to memorize, okay, this are safety points. So I don't have to forget. I'll do in a flow, but I'll not forget the patient safety points in that situation. All right. So please keep a note of that in exam so that you don't forget these and practice from the start. This is the easiest domain for MRCOG Part 2, January 2023 passing students. Why? Because you are the most fresh in the updates of the green top, the nice, and the talks, and you're really, really clear on this. Yeah. So applied clinical knowledge is your strength now. You all know it. You need not go back to the main guideline. You can simply revise your notes, right? But one thing is that you know everything, but how to put it into words, how to explain that into words, and how to check the understanding and do that in that minimum time period is basically the gist which we have to understand. All right. So the applied clinical knowledge should not be like scattered gun. For example, we've got a premenstrual syndrome. It's an exam tested station. So in PMS, I expect you to go with a lifestyle modification, then telling about the patient in a sequence, that what would be the applied clinical knowledge in the first step, like SSRIs, like COCPs, yeah? Then you're going to go to the second step, increasing the dose of those medications. Then the third step of those injections of gonadotropin-releasing hormone, and then coming up to this or to the hysterectomy step. If you start with SSRIs and then you speak hysterectomy, then you go back to increasing SSRI, and then you go to the complementary therapy. Then you realize, no, we had GnRH as well. So if you just be a little scattered gun and you're like not being in an organized manner, examiner realizes that you have not well practiced, or you're nervous under the exam situation. All right. So doing an applied clinical knowledge in a perfect manner. So it's like, it's pleasant to the ears, and you are going in a sequence, and somebody who has learned that applied clinical knowledge, doing that practice shows that how you have to do it beautifully. Please don't be patchy in your applied clinical knowledge. Practice it in a beautiful manner, right? So just brush up your information, just like 15-20 minutes for each guideline. Do not open up randomly the station you're doing. For example, next week we'll be starting with the modules, right? I will give you an example. It's an ectopic pregnancy. Okay. So what you'll do is you will do the ectopic pregnancy station from you'll open up your recommendations of the notes. You'll revise them in 15 minutes. You will open up the MRCOG patient information leaflets of ectopic pregnancy and do it in 30 minutes. Then you will go to the stations given in the exam tested folder, right, which you have in the study group. You'll see that how ectopic pregnancy has come, or you'll go to the website and see its solved template. This is what is required for one topic. Do you guys understand that how we do one topic, right? So the most important thing is that organizing yourself outside in the when you are ready to go inside. Why? If you don't understand the gist of the station outside, you create lots of confusions inside. So 2 minutes are there. In the first session, when we'll start doing the stations, I'll prepare you guys that what you have to do in those 2 minutes. And I'll ask you, what are you doing in those 2 minutes? You have to be very clear that what points you have to take. For all students who are face to face, you get a writing pad and you get a pen. So you can do all those important things. You can write down all those important things there. Okay. So 1 minute, be a fast reader. Please, from today, be fast reader. I've got many students who say that, ma'am, unfortunately, we could not get the hang of the station and we had to move in because 2 minutes were over. Not all friends, but yes, around 3 out of 14, they are generally big stations, like 4, 5, 6 pages, just to, test your nervousness and to give you a difficult time. Yeah. So please be fast readers from day one. Try to read as fast as possible and take points from day one. Please do not read at leisure. Do you guys remember how I used to tell you for the single best answers that please don't do that single best answers lying down in your bed and on a leisure, on a study table, that yes, you're solving the extended match question against time. Yes? Do you remember my advice for MRCG part 2? Same advice I will give you for MRCG part 3, that on day one, study pattern, please do it with time. Whatever station you're reading, read it against keeping 2 minutes time. Because if you start taking like 5, 7 minutes to understand the station, so then you will have this, spinal reflex of like being slow reader. Do you guys understand this? Because you've got only 2 minutes to understand the station and inside. Whatever you do is on the basis of that 2 minutes. This is the most important thing. Inside, when you go, you start with your introduction, you do an agenda, you start information gathering, you address her concerns, give her management plan, check patient's understanding, and give a written information leaflet and close the station. Again, 30 seconds for your introduction, 4 minutes for your patient's information gathering, and then good amount of 4 minutes in management plan and addressing her concerns, and then 1.5 to 2 minutes in closing the station. This is outline of 10 minutes. Do you guys understand? Do you guys understand that how we have to time ourselves? Because time management would come with practice, and we have to start from today. That's the only way we are going to have our speed, right? So you should not be very fast. You should not be very slow, right? You should be knowing that what are those points which I have to speak must to get to that point and get to the scorecard. All right. So the biggest important thing is that you should know the idea of the station. You should address the concerns and reach up to the expectations. Again, the most important thing which you have to understand is situational awareness. Who you are, you're an ST5, or at times they give you a station that you're a consultant, right? Where you are in an antenatal clinic, you're in early pregnancy clinic, you're in a contraception clinic, you're in a pre-pregnancy clinic. What type of station is it? Whom you're meeting? Is it like SPT? Is it an ST, structured discussion, or is it simulated patient task, right? What type of station it is? Have a situational awareness, like it's a breaking bad news. Please don't come with a smile inside the cubicle. Have a control of yourself. Be calm, composed, and serious. It's a debriefing, or it's a cheerful station. It's an angry patient. It's a sad patient. 2 minutes are very crucial. And believe me, if you rehearse your 2 minutes well, you are really good in your practice. Now the question comes, face-to-face versus Osler. Generally, there are lots of things which I've spoken in my voice notes as well in the open Telegram. You people can check it out, but these are the differences. In face-to-face, you understand the role player. They're in front of you. No chance of a technical glitch is there. No voice problem is there. And it seems like you're sitting in your clinic. So it's like more of your, hospital environment. In Oslo, The benefit is that we have 7 stations and then a break, right? In face-to-face, we don't have a break. In online, we have a break after 7 stations, around 10 to 12 minutes, and then from 8 to 14. So you can eat, you can attend toilet, you can quickly get back to your seats. It's a break after 7 stations. It's a relief for the Osler students. You can do your time management really well. In face-to-face, there's no timer. In Osler, on your screen, you've got clock, and that goes from 10 minutes back to 0. So you can speed up yourself, you can slow down yourself. And I always say that this is the biggest advantage of Osler, that you're not scared that I'm going off track. Okay, you see that, okay, 3 minutes are left now. I have to come to this point. 1 minute is left. I have to give it a beautiful ending. Yeah. And one of the most important advantage of Osler is that you are at your home. You don't have to travel. Of course, that calls for your comfort zone, and there is no the finances, of course. So lots of things. And at your home, just in your room, creating an environment of like having a table and a chair and an internet connection. So that definitely plays its role. And for many students who can't travel, so this is one of the basic advantage which we have for the Osler. So now let's see the disadvantages. Face-to-face, of course, involves the traveling cost. You have to reach to the center, right? At times it can be a different city. At times it can be a different country as well. Okay. So undoubtedly, reaching to an exam center, you have all been through Pearson. It does have its stress. Okay. You do have a tachycardia, no matter how much you're prepared, how well you're prepared. It does involve the, stress. So that's one of the disadvantages. For Osler, the biggest disadvantage is the internet connectivity. You know why? Because it's not about your internet. You can get into your internet. For example, in February exam, 2 of the students, they had a cancellation of the exam. They couldn't see the road player. Then they couldn't listen to the examiner. Then in few of the stations, their internet wasn't working. So you are dependent on your own internet, your examiner's internet who are in different part of the world, your role player's internet who is in different part of the world. So the technical glitch is the biggest thing. Then you have a rerun, in Oslo, if like 3 stations, they get like a technical glitches there and you can't be marked on that, then you have a rerun. So the exam gets over, they make you sit, you can't log out from the application, and that station gets rerun. So of course, when the time is passing by, your tachycardia is more and you tend to get a little, confused on this. So we have to practice for this, that even if it's a rerun, it's okay. So good internet connection for yourself, for examiner, you're dependent upon their connectivity. In face-to-face, no break is there, as I've told you. At times, this is the, students' observation. As I've told you, this is the circuit. In few of the centers, students were saying that, ma'am, we were in our own circuit, right? Like, for example, you are in this cubicle, right? And through the cubicle, you can listen to the other. So that's like a little distraction. So I always say that when you're in the last month, I always tell my students that please practice in noise. So practice where other people are also talking, so that you have that, focus. Even if somebody is distracting you or you can listen to other voices, you maintain your focus. In face-to-face, at times, the cubicles are so closer that you're doing your station and you can listen to the one who is next to you and the one who is like, behind you or coming up. Just like, for example, you're in station number 6. You can listen to what is happening at 7 and you can listen to what's happening at 5. So that is something which you have to, be practicing with, that you should have your focus even if it's a noisy environment. All right. In Oslo, of course, you should be very good in technology. You should be knowing about Zoom, the laptop, the keyboards, the typing skills. As I told you that in face-to-face, you get a writing pad. In Oslo, guys, you have a virtual pad. And in virtual pad, it's visible on your screen. You cannot write on that. You type on. Okay. So you should be very, very good in your speed on the keyboard. You should be able to type, because in Oslo, you have to type what you are like, the points which you want to be in front of you at the station, right? You should have a good screen, please. I do not recommend small iPads, or for that matter, the MacBooks, which are small in screen. I told the February students as well to have big screens for Osler, please. The reason for that was that it's at times the stations are very tiny, very small. right? So you should have a very good screen, a big screen on this, okay? So face-to-face reading on the wall of the cubicle that needs practice. I always suggest students because, they're always fond of like reading the book on the table. So when it is on the wall of the cubicle and you have to see on the cubicle wall, it's always a little problem. So in the last 1 month, I tell them that please stick your stations on the wall. Please do that in your room so that you know that you have to read on the wall only. It's not going to be like, on the table. Inside it is there on the table, but outside it's on the cubicle wall. And again, timing has to be perfect. It's the biggest thing in face-to-face because you don't have any idea of the time. Only your speed and your practice is going to tell. All right. In Oslo, no disturbance is there, but at times it is something like staying alone can also cause a little difficulty for you guys, right? So this is the difference between the Oslo and face-to-face. Now you guys have to understand and decide as per your choice what suits you best. In May, we do have an option, but in November, they have not announced. All right. Let's do a quick recap of SPT. For all simulated patient tasks, you'll introduce yourself being a doctor to the patient, no talk to the examiner. You will make an agenda, which means that why she is coming here. You will start taking history, would examine her and offer investigation, explain to her the diagnosis and management plan, and close with a clear action plan. With this, you should be knowing in an overview that history taking in an SPT station should be detailed, right? Depending upon what is the requirement, all right? Structured discussion is according to the questions which the examiner is going to ask, all right? So regarding the session, we'll have all the modules and all the domains module-wise we are going to do. We'll start up with everything. 12 live sessions would be there, and they're going to be covered up. Every session would have 7 to 8 exam stations, and I'm going to solve those exam stations already after you do that, after the feedback. We'll tell you exactly that what is missing and what you need to practice more in your mini group. You will be told about that. What are the topics? Whatever topics we're going to do are going to be the exam one. Anita, they're going to send you the link. If you are in UAE, you'll get the Oslo link, of course. Okay, you'll be priority on the Oslo link. Okay, now part 3 is not a one-day job. It's slow and steady learning. With the same zeal and zest, I don't want you to discontinue that zeal and zest and the same enthusiasm. Start enjoying and understanding this communication. This is about how you present yourself, how you speak. Having belief in yourself, you know what? There would be a time after 2 weeks that while sleeping, you would be saying, "Hello, I'm Dr. Anita. I'm one of the doctors in the contraception clinic today. May I confirm your name and age?" And there would be a time that you all would be doing walking, taking breakfast, lunch, dinner. You all would be speaking and doing this practice only. This is something which happens very commonly, that you start absorbing this and it becomes your routine. Taking the history, I always say that you start taking history on the breakfast table, on the lunch table, on the dinner table. That gives you such a good flow that it becomes your practice. And it is possible. It's totally doable. I did it 1.5 months only after part 2. Many students are there who did in 1.5 to 2 months, but it demands time. It definitely demands time, right? So do not go to the detail, please. Only the green talk guideline, the nice guideline, and the talks, only brush up that information which you people need, right? So you people should be knowing about all this, that it is a time to take a start. And you should be very, very clear that people before you, they had been doing it the same way, right? They had wonderful, wonderful success. Their results, they just came like 2 months back. They all did it both ways. If you need time, even then you need to give. Like for November students, November 2023, I just want that you guys have the around 2 hours daily. For the May students, I expect that you guys have 6 to 7 hours because we've got very less time. All right? Yes? So this is my expectation, but you have to start now. Reason for that is that delay in MRCT Part 3 speaking, that definitely adds on the stress because it's your presence of mind in those 10 minutes which you people have to remember. There were so many passing students in that exam, and all your friends, the success is going to come so much. Yes, Rafi, hoping the same results for the February batch as well. So the ones who are asking for the link, please, thank you very much, Saima. You all would be like this. They just did it just with the continuous practice, and there's a huge, huge congratulations and celebrations result it was. And all those who are aiming for the November, please go through the link, the same one, please. And all those who are going for these exams for the May, and I think 76 batch has few seats, then I'm going to just make it open. What I want is, do I need extra preparation time more than 6 hours a day? My question is, I passed MRCT on September. Yes, Asma, please. Asma, I expect now 5 hours at least, my dear. Even if you're starting now, because we've got only 2.5 months now. All right, that's the reason. Okay, yes? All right, I'm here for the questions, please. All the questions which you people have for the preparation. Please, Anita, yes, you can unmute. Everybody can unmute whosoever wants, please. Yeah. Yes, my dearest Anita, yeah.
Good evening, ma'am. Good evening, everyone.
Thank you very much. Happy to have you here. Asking questions not about MRCT Part 2, huh? Asking about MRCT Part 3.
Sure. Thank you, ma'am. I am
Yes,
asking if I'm not getting the chance to sit for the OSLA, so whether this subscription will be converted to the November?
No, actually, the course is same as that of Part 2. That if you are in the May batch, if you are in the May batch, then your access will be till May. If you are in the November batch, then the access is till November. Now, if
No.
you're in May batch and you don't get the seat, then because you're in active, you'll have to utilize it. And then in 125, you'll have to do the extension. All right. As you people used to do earlier. Then extension has to be needed because the course will get completed. So May batches are till May access. Then extension can be done of administration charges. And the November batches are till November. The access is till November because that will go slow.
Okay.
All right.
Okay, ma'am. Thank you. And then, ma'am, the OSLA booking will be same on the 2nd March. They will send the links.
Yes, my dear. They're going to send the links.
Okay, ma'am.
Yes. Thank you. Any other question, please, regarding the preparation, guys?
Ma'am, are they here?
Yes,
hello,
ma'am.
Yeah.
Hi, ma'am. Yes, my dear.
Yeah, ma'am, I wanted to know, like, when you will start the regular sessions.
My dear, I planned for you for your batch today but because you people were not ready, so now next week we'll be starting the first. So today I'll be giving basically the second. You have the schedule, right? So the first session was planned today, but now it would be next week. So one session we are going to do until the end. Rest the schedule would stay the same. All right.
Okay,
So
ma'am.
today we put the topics and the moderator will take you forward. All right. And 24/7, the moderator is there, friends. I expect
Okay.
that you guys put your recordings there. And for 74, 75, 76, Madhu is going to give you the feedbacks. All right.
Okay, ma'am.
So that you people get corrected. 10 minutes, just put it there. Now, even if you meet up in your mini groups, try to spend like 1 hour a day speaking to each other.
Okay.
All right. That's very important, please.
Okay, ma'am. Ma'am,
Okay.
what about
Hi,
this
Dr.
fast track? If I want to join fast track as well for the
Yes.
May.
So the fast track is going to be 100 different stations. 100 we do in this and 100 we do there. So it's basically different stations, no overlapping is there. Almost all the students, they join after they get the seat. For the active, it has to be the complete payment with the same coupon which you people have used now for the regular. But for the listener, it's 50% off if you want to just get the stations. But if you want to speak, then you can do actives. Already, I think many have registered, and the listeners also. You'll get those stations audios now, starting from now. If you think that you want to, prepare in time before that. Okay, so these are till recent stations. That would include all the exam till February 2023.
So, ma'am, I need to. Can you just send me that fast track link as well?
I'll send
I
you
think.
both of them. Yeah.
Okay. Okay. Thank you, ma'am.
Yeah,
Thank you.
both of them are here.
Hi,
Okay,
Dr.
thank you.
Sidra.
Hello, hi.
How are you? Yeah, I have a
Hello.
question. If I'm sitting for this May exam, if I want to start,
Appears as iPhone.
sorry?
Your name appears as iPhone, my dear. Let me.
Yeah, I'm Rawad. I'm Rawad.
Rawad. Yes, my dearest Rawad. Yes, please, my dear. I've named you.
Yes.
Yes, my dearest. Yeah.
So if I want to start tomorrow, is it the best option is to go to the website and read the patient information leaflet, or should I just
You're in
I don't know,
74,
wait
75?
for
You're in which batch?
74?
You're in 74. Okay. So what you're going to do is that today by night, we are going to put all the schedule. What is the session next Sunday? Right?
Okay.
So you'll start, first of all, let me tell you guys. Ritu, what is the next Sunday session? What was the module? Ritu, my dear. Sindhu, where are you guys?
Ma'am, it's maternal medicine, ma'am.
No. Next one,
Maternal
which was on Sunday.
medicine.
No, next one, which was on Sunday, sweetheart. Because maternal medicine we'll put in the end. Yeah. Next to maternal medicine, what was that? Hold on, let me open it. Yeah. So the next one is surgical and post-op. All right. So Ravan, next Sunday you have surgical module, right? So what you'll do is that just now the moderator will give you the 8 exam questions which are coming, stations which are coming. It's a hematoma. It's the bladder injury. It's fistula. It is the hysterectomy steps, which is very common station. They give you a mannequin and you have to perform the hysterectomy steps. All would be given. She will give you a schedule. The daily you have to do one topic per day. You'll go to the website, open its template. In the surgical, you'll open up first of all the surgical module history template. Complete history of surgical module questions would be there. You'll start practicing it. Then you'll go to the patient safety module, to patient safety folder on your website, and you'll see in surgical module what are the patient safety points.
Okay, so it's topic based, and then based on the schedule, we go to the website and then we check what the PILs are, and then we can start.
What you'll do is that daily you'll do one station in your mini group, and you'll practice with your mini group people that today we are doing these 7 we have to prepare before we meet ma'am, right? So those 7 daily you'll do one, and then finally you guys are going to meet me on Sunday with surgical module. The benefit of that would be you have rehearsed yourself. You'll open up the templates in front of you. Then the presenters would present. I'll give the feedback, and you'll finalize your template and come up with the queries that where you guys were being troubled when you were practicing yourself.
Very good,
right?
very good.
This
And
is the way. All the templates are solved on there. And one more thing. If you go to the audio library, you open up the surgical module, all the stations of the exam, I have my audio library. Going into the hospital, just put it on your earphones and listen to those, because everything I have solved, that how you have to talk, how the exam station was, all those 7 stations in form of audio is solved already in your library. with
I see.
chapters. Like you can just click on them. Okay. So
Perfect,
that tells
perfect.
you that, okay, these points you don't have to miss. Yes,
Last
Rob, yes.
question is
Yes, please.
the timing of the discussions on the group. Is there like a set timing, or should we just
Individually.
agree on the group?
You know,
Oh, okay.
Ravit, let me tell you, the UK students, for example, Rati and all, I generally tell the coordinator to put according to your time zone so that there's a gap of like 30 minutes or 1 hour. So I always say that you're 5-6 students in each mini group. Even if you're not able to gather 5-6, even 2 are available, please meet. No problem. For example, if you get like anybody's free, please today, we're going to meet like 4 p.m. GMT. If you get one person, just start practicing. Next day, if somebody like 3 others are able to meet, it's all right. So the idea is somebody listens to you and you listen to somebody and come up with the questions. Put the questions in the mini group that here we are facing difficulty. Are we on the right track, please? The moderator is going to tell you. Get it?
I see. I see. Thank you so much.
So don't be silent. Come up with the questions. Like in, first time you'll make mistakes. Always the main group you people are putting in your recordings, and when the moderator is giving the feedback, please listen to the one who has put in the recording and the moderator feedback, because that would correct you as well.
Yes,
because you will understand, okay, yeah, she did this point good, that was appreciated by the moderator, or this point was basically told to change, so I should not do it. Yes.
Okay.
So always it's not that you are looking at your feedback only. You have to listen to others as well, because that feedback also makes you polish in your skills and speaking. Okay? Got it?
Perfect. Thank you so much.
That's lovely. No worries at all. Any other question, please? Anything which is still in your mind for MRCOG Part 3 preparation? I tried to take you guys, slowly to understand this. It was like a meeting which you people were waiting for. Now, any other question anybody has, please, I'm happy to answer that question.
Ma'am,
yes,
can I ask?
Sure, please. More than welcome. Yeah.
Yep.
You are talking about your audio.
Hello?
In the portal?
Anita, yes, website. Log into website. Yes, my dear.
Okay, because I will see again. Okay, ma'am. Thank you.
Yes, please do see that. And if you don't get anything, just put in the message to the support team. They're going to guide you. Okay? Right?
Thank you, ma'am. Thank you so much.
Thank you, my dear. Yes, Shweta. Yes, sweetie.
Ma'am, I wanted to ask if in case, because in India we have both on-site and Osler, can we still enroll for Osler despite having on-site exams
Shweta, last time, what they did was that they gave the priority booking. For example, Indians, they got only for the centers, the links for the centers, right? So then the seats were left. Right? Students were less, the seats were left. Then they opened in the second booking, they opened India global, that whosoever can travel, they should entertain. For example, I told you, like my Bangladesh students, they came to India, right? Okay. So Oslo, actually what happened was that Oslo, other than those who are having the centers, they got the link for Oslo. And unfortunately, seats were not left. After that, if at all it would be left, yes, in the secondary, in simple words, being in India, you will get, last time what happened was, if they're changing this time, they'll be updating. But last time what happened was that wherever you are, that's your priority booking. I mean, the first link you'll get. The second booking, you only get if the seats are left. Do you get it?
Yeah. Yes, ma'am, I got it.
And
ma'am, for now, we should start with the website and we should start the surgical module. Right?
Yes, 74, 75 and 76. Yes, 74, 75, 76, you'll be starting with surgical module, and it's going to be next Sunday. Okay. That would be yours. So this Sunday. 6 days you're going to do. Yeah, only the maternal medicine, which was scheduled first for 74, that's going to go in the end, like antenatal and maternal medicine, that will go in the end. And rest the schedule would stay the same, but it will be posted. Presenter list and everything would be posted. Okay?
Okay, ma'am. Thank you so much.
Thank you, my dearest. Any other question, please?
Hi, ma'am.
Hello, my dearest. Yes, please.
Ma'am, I have one doubt. Ma'am, if we get a link for offline booking this time from India, and I want to wait for the Oslo booking, so should I wait or should I book at the first priority booking?
My dear, it's basically basically risk.
Yeah, that's what. That's what.
That what if you don't get an Oslo?
Yeah, exactly. So what do you suggest, ma'am? Like whatever we get, we should book whatever token we get, we should book that seat.
Yeah. So I think we should not take a risk. And
Yeah.
if you are getting the first and if you're getting the seat, so it's not 100% guarantee that you'll get in the second link, you know.
Yes,
Mm,
ma'am, that's what.
yeah, because many people
Yeah.
from different parts, like UAE students, Egypt students, they all be going for Oslo. So you never
Yes,
know that
ma'am.
you don't get an opportunity to do Oslo at all. Yeah, Noor?
Yes, ma'am. Yeah, ma'am, that's what. Thank you, ma'am.
Thank you, my dear. Ola, you want to say something? Ola, you have shifted to November, huh?
Yes.
Yes, my dearest, yes.
Doctor, first of all, thank you very much.
You're welcome. My welcome.
Till now,
Yes.
the idea of MRCOG Part 3 is not understand to me very well.
No problem, no problem. I totally understand that. So we are just going to have it more discussion in the November. You've got too much time. Every session would be like with a gap of like 2 to 3 weeks.
Yeah.
Yes.
Doctor, I asked you, I am past MRCOG Part 2 in September. And I don't cover all the material of Part 2. And now I want to enter the exam of May, but I am afraid from May, so I delay for the November.
Yeah, we have shifted you in the November batch. It's okay. It's okay, my dear. Having a good preparation is better rather than, you know, going hasty.
Okay, Doctora.
It's a
Now,
good decision. Yes.
how I will start to read guidelines or information leaflet?
So you'll pick up one module as per the schedule we are going to give. For each module, you'll pick up one topic, which would be from that module in the syllabus, right? For that one topic, you will open its guideline. If it's a NICE, if it's a GTG, if it's a talk, you'll open its patient information leaflet and you'll open the library for its templates. So these three things you will be doing, your topic will get covered. So I don't want you to learn the, you know, all the topics randomly, because reading the guideline without learning the understanding the system or understanding the station, that's a waste of time, because here they're not going to test you for your knowledge only, but you should be going up with this one by one. So for all these three things for each topic you're going to do to cover that module, and you will have 3 weeks to cover one module.
Okay.
Okay. Yes, please.
Okay, Doctor. Thank you. Thank you.
Thank you, Matiola. Stay in touch, please. Huh? Keep practicing. Thank you, Matiola. Thank you. All right. Any other questions? Yes, hello.
Can I just ask you a question, please?
Yeah, who's this? Sorry, your name.
My phone, Dalal.
Who's this? Sorry?
Dalal. It said iPhone. Yeah.
Thank you very much, my dear Dalal. Yes, please. No worries. Please, yeah.
So I just bought the last exam, and I'm planning to get to the May. I'm here in the UK, so I'm worried about if I got like face to face or Osler.
Dalal, you're in which batch?
I just will join right now. I didn't pay. I'll just
will
join right now.
You'll be in the 76, right?
Yeah, 76.
Yeah, you'll be in the 76 then. Okay, yeah. So you'll be in the 76 then if you're joining today. So what would happen is that in this situation, you want, being in UK, you want Oslo, is it?
I'm currently in UK, working in UK, and I'm planning for Oslo.
Your address with college is UK?
Yeah.
So the chances basically you're going to get a link for UK booking.
Yeah. Okay.
If you have this some sort of, you'll get a link of UK booking actually.
Okay. Regarding the fast track and regarding the regular one, do I need to book for both of them? Because as far as I understand, there is like 100
different
modules
stations
here.
I won't say that it's a necessity, but if there are no sort of a financial constraints, then yes, you can take both of them. But the difference is that to make a basis regular is very important, because we do module wise. The fast track is very fast and it is not module wise. It's like paper wise. It's like all the stations. It would be early pregnancy as well, antenatal, maternal medicine, everything would be in one session. So we do like complete exam. Yeah. So it's different. They're going to have this time 10 to 12 sessions there, and it would be fast. So if you don't understand the modules, then you would be very difficult for having like, mix up. So it's like all the mix up things in one session. So if you want to book as an active, then you can do now. But if you want to book as a listener, then it's not a problem. After your booking of a seat, you can do that. Okay?
Okay, so you recommend that being to get the basis, I need to be on the regular course. Then
Regular is very important to have the basis and understanding.
Yeah,
Okay,
and
because that's like, if fast track, I always suggest to those who have had their basis of MRCT Part 3 and they want like a quick thing from this time. So to start with fast track is very difficult to absorb because it's very fast. It's just like you imagine yourself that my fast track of MRCT Part 2, right? If you don't have a regular basis, if you don't have the learning of the guidelines, you can't just directly go to the questions, right? So same thing you can understand this way as well.
Okay. I get it. Yeah, thank you so much.
Thank you, my dear Isla. God bless. Thank you. Any
Good
questions?
evening, ma'am.
Hi, hello. Yes, my
Soumya
dear.
here. Good evening, ma'am.
Yeah.
Just a quick question. Now, you were telling us about the time management of 10 minutes with 30 seconds of introduction, agenda fixing. Can you just repeat that? I just could not get it. I missed it. 4 minutes of.
So 2 minutes you have outside the cubicle, my dear. Right?
That's right. Yeah, I
So
got it. Yeah.
It's outside the cubicle. 2 minutes, of course, you can't read. You should complete your reading in around 1 minute. And 1 minute, organize your thoughts. Okay, I'll enter saying this. I will be asking this question. If it's a VT station, I would like to know about BMI, about the thrombophilias and stuff.
Okay.
So this should, we should be knowing about this.
Yeah, once you enter there,
inside, then your first 30 seconds would be your introduction, where you are, who you are. And then you start doing your information gathering, 4 minutes for the information gathering, asking the history, completing your history template. Then around 4 minutes time for your information giving part, that is how you're going to manage.
Okay.
Right, with addressing concerns. And last 1.5 minutes if she has any question and address concerns and then give a closure.
Got it. Yeah. Got it. Thank you.
Yeah. Thank you very much, my dearest. Thank you. Any further question, friends? So are you now clear about MRCT Part 3, what it is, how we're going to start? Ritu, fast track, absolutely. We have made the schedule on 10th of Safa has made the schedule from 10th of March, my dear, because that's the booking date. All right. Asma, the fast track active is for regular students, it's 665 and the listener is 50%. Where are you guys? I'm just going to send the link. Where is it going to be? So it's 50% off on the listener for the regular students, of course, and for the active seat, it has to be complete because that's something like, I'm going to have less seats for the active. All right, we'll be starting that. The batch has started, but the schedule will start from 10th of March. Fast track always starts from booking. So your booking date would be the starting of the fast track. All right. If we have to do, back to back, it will be like twice a week sessions and very fast sessions. Yeah. Thank you, my dear. All right. Any further question, please? Somebody was speaking something, please. I missed out the question. Yes, different dates.
I was asking about the fast track, but you answered it.
Oh, okay. Thank you very much, my dearest. Thank you. All right. Okay. All right. Any other question, please? So we have promised that we are going to make it a success the same way as we have made the success for the MRCOG Part 2. I want you all to be focused from day one. I would like to say that we have lots of shortcomings. Every individual has got weaknesses. We just have to turn those weaknesses into strengths and make ourselves so powerful that the moment we start the station, the examiner realizes that it's a well-rehearsed and a confident candidate, and you expect nothing but being successful. All right. So I'm with you in this journey. All the moderators, the coordinators, we are here to support you guys. The more you're going to speak, the better it would be. When we know that this is about speaking and communication, start doing all understanding the system. You all can do it, but just analyze yourself, sit and see that where you guys need more practice and start working on your weak areas, not tomorrow, but from today. Thank you very much. Anything you need, you can ask for your links in the study group, and the team is going to provide you for that. Love you all. Take very good care of yourself. Thank you very much for your precious time. Congratulations once again. And let this congrats and this celebration continue in this 2 months' time. Let's meet in another congratulation meeting of MRCOG Part 3. Love you all. Take very good care. Bye-bye. Thank you so much. Happy studying, guys. Thank you. Bye-bye.